Hello, our YouTube family, and thank you again for our monthly clip on eye care. This time, I'm going to talk about concussion and eyes. Now, what is the definition of concussion? Concussion is a mild traumatic brain injury. You may not able to find any trace of brain damage from your MRI, from your imaging. But again, the injury is so mild, it's not showing up in imaging, but the damaging is there, affecting your nerve fiber, affecting your axon. In other words, affecting the cable transmission of signal from your sensory organ to your brain. Now, first I want to tell you how severe, how often that concussion or mild TBI occur. According to statistics, in 2014, almost 3 million concussion-related emergency room visits also occur in the United States. Now, that even not included those that the mild concussion is so mild that they don't think it's a big deal. They do not even seek any medical care. I can tell you that of all the people that go to emergency room, those are more of a severe case, more obvious one. Those people that have vomiting, nausea feeling, have dizziness, so severe they feel they're scared, they go to the emergency room. But I can tell you a lot of it, children, adults, the same way, they don't feel that much a big deal, but they come back and haunt them later on. So again, about 3 million every year. And again, of all the injury, of all the concussion, 4 is almost like half of all the TBI-related emergency. Fell off from a ladder, fell off from a pavement, running too fast, you fell down and hit your head. Sport-related concussions like get knocked down on the field because of body contact, basketball game, football game, and even sometimes can be just simple weight lifting exercise. You can also slip and fall on the ground. And motor vehicle crashes is the second leading cause. And again, the third is struck by or anything that is an object that is is probably among the youngest population, hitting by any foreign object. And again, I want to bring all this into attention. It's also head-to-head injury, like when you're practicing football. Helmet to helmet, there's also one of the leading causes of the mild TBI, or what we call concussion. Now, the common dysfunction after you have a concussion is that, of course, all senses will be affected. The ear, your body, your proprioceptor, your eyes, your vestibular system, your hearing, everything of this can be affected by the concussion. However, the vision is the one that mostly affected. Vision and the vestibular system are the one that's most occur after the concussion. It's because of the fact that most of the injury, most of the concussion is occurred to the head and your neck. The neck, around the neck area, have a lot of nerve passing through from the base of your brain to the face, to your eye, to your ear. So anytime when you have this kind of whiplash type of injury, causing injury to the neck, your hearing, your eye is going to be greatly affected. Once you have concussion, you also notice that you have multiple concussion after that, because of the fact that because of the previous injury affect your balancing, affect your walking, and it's even easier for you in the future to get further injury. So what is the symptoms? What will you immediately think this is a black flag, you need to seek help? Blurred vision, especially at near. Regardless of age, doesn't have to be older or younger. Anytime you notice that your vision feels blurred, especially close up when you're reading, seek help. Dizziness, nausea that lasts. Especially dizziness is when you're walking, you feel the dizziness, you become unstable in your walking. Binocular vision dysfunction, this is a big thing. You will notice it never happened before, but the word move. When you're driving, you notice that the sign becomes, move, the letter on the sign is moving up and down, moving sideways. Or worse yet, you notice that you see double vision. And those are the warning signs saying that the concussion is so severe, they affect the cranial nerve, they affect your cerebellum. And light sensitivity is sound sensitivity. Light sensitivity is because when you have certain concussion, your filter of your ocular system was taken away. Normal light that you don't bother by it now suddenly have 100 times more irritating to your eye. Sound, normal talking, normal music you feel like is irritating to you is because of the vestibular system was being damaged. And loss of concentration and memory loss, of course, this is more higher level to your brain level. You're not able to concentrate, and you also have, again, you notice that what you talked about yesterday with your friend and colleague, you cannot remember. Those are early sign of some higher brain dysfunction. Imbalance, as I say, imbalance and unstable in your movement, those are the warning signs of the after effect of a mild TBI or concussion. Now, what can you do? Of course, multiple things. You need to see a physical medicine doctor to make sure that they get a good diagnosis of what happened, to make sure that you don't have any brain dysfunction, cerebellum dysfunction. And regarding all those visual or visual problems like what I talked about just now, normally we are able to prescribe prism glasses to alleviate the problem, bring your life back to normal as much as possible. We also have vision rehab training that we're able to, again, regain your motion, regain your visual system so that you will not experience any of those discomforts. And lastly, sometimes if it's because of sympathetic system is overriding your parasympathetic system, we can use some phototherapy through the eye to calm your nerves so that you're able to, again, feel more comfortable in your everyday life. I hope this will able to, again, have a good start for you. For those people out there that have experienced all those symptoms after concussion, seek help. Don't wait because it's not going to go away. You need to take care of it. Thank you again for your time and watching the video, and we'll see you again next month.